Managing your rotas, HR, and general financial state of your practice has always been a challenge because, let's be honest, a lot of the commercially available tools don't work when it comes to general practice or integrate with the systems that we use. That is up until now. So join me as I'm joined by the team from Tempo as they share their ground-up tool that they've created to help you do all that and more in general practice as we tech enhance your primary care and learning. Hello, GP learners. Welcome to this episode where I'm really happy to be joined by the team from Tempo as they show their tool that they've been creating for the past few months, years. I'm not quite sure. It's been in their minds for a while, but showcasing what they can do to help you with a variety of aspects when it comes to your managing your practice, network, wider kind of team and stuff, particularly some of those more challenging aspects. How are you doing there, guys?
Good, thanks. Nice to see you, Gandhi. Yeah. Thanks for having us on.
Definitely. Yeah, so I'm going to get the team. Thanks. So I'm just going to get the guys to introduce themselves. So Phil, should we go to you first of all?
Yeah, so my name is Phil Varlick. I'm a GP and I practice in Lewes in Sussex.
And James?
My name's James Annis. I'm also a GP in Sussex in Lewes.
Awesome. So some of our EGPers may remember Phil joining me and Andy on the channel about a couple of years ago when we were talking about some of the really cool work that you guys were doing as part of your Foundry PCN. And that was some of the stuff that was in the fuller stock take and various other things. I know since then you've been working on this particular project called Tempo. Tell us a bit more about that.
Yeah, thanks, Gandhi. Well, absolutely. So all of that experience that we've gained sort of trying to work at scale. So Foundry, we were recognised as coming together with 3 practices, forming a single practice PCN, working around patient segmentation, understanding demand and capacity. Now, it's not easy and it's a bit challenging. And I think what you find is a lot of the processes that we have in primary care actually are the barriers that hold us up kind of making change. Understanding our workforce, understanding the demand that we've got with patients. And so that is a kind of key thing that we need to understand a bit better. Now, we had been using lots of spreadsheets, lots of other systems that didn't really work for us. So that's when we started to kind of look at different ways of trying to approach that. And that's where Tempo came from.
Mm-hmm. And in terms of creating that tool, so what exactly does Tempo do? Because it does a lot, doesn't it?
Yeah, well, we started off thinking about rotoring. So what we actually started off looking was we had 3 GP practices working together and we wanted to understand how many people did you need on each given day, how many doctors should there be in, how many duty sessions that we needed. But then when we were working together, how could you get those practices to work together to form a hub where we could see patients collaboratively, share the workload. So that's where it started from. So that was rotoring. Now we built that kind of MVP then initially in kind of spreadsheets, which then started to come into a platform. But as that evolved, we realized that actually when you're doing rotoring, what you really have to understand is leave and the HR part of it. So when are people off, when they're wanting to request leave, and then set basic minimum for the number of people who need to be in. And then following on from that, the platform that we started working, and we built that on top of GPNetworks, which was a locum booking platform. So we were able to integrate the finance side of things. And it's really interesting when you bring those things together. So when you start to have finance, rotoring, and the HR with your leave requests all in one place, that really starts to allow you to do some really interesting things around forecasting and around about looking for different ways of working in the future with changing your model of care, but looking at productivity. So really looking at how much does this cost my practice as a whole? How could I do that better? And we've then reduced our locum costs, increased usage of then salary GPs instead of locums, cut our locum budget significantly, all at the same time as saving time with our administration work around the kind of the rotoring and the finance as well.
Yeah. And I can definitely see how that'd be valuable. So, generally speaking, a salaried costing model will often provide less fluctuations than a locum-based coverage and stuff, as well as technically should be better for the business in terms of cheaper continuity, all the other kind of stuff as well. And I guess when you match that up with demand level data that all practices should be able to now have through things like cloud-based telephony, all the other kind of tools that we have, means you can, like you say, predict and forecast what you need more effectively and therefore be more consistent. Fingers crossed, better morale as well, I guess, with that, because you're not having to scramble around for last minute staffing issues or that kind of thing.
Yeah, that's absolutely right. I mean, I think control is what I would say is what we're trying to achieve, whereas a sense of control. Because actually, what we tend to be doing is the day happens and this circumstance has happened. We've had people being off on leave. There wasn't enough people in. You could have seen that coming. There is a predictability about these circumstances,
Hmm.
and it's only when you look back in retrospect that you start to see what happens. Demand, as we've been tracking over the last 2 years at Foundry, you realize how absolutely kind of reliably static it is. It varies in different parts, but actually it's something you can say is steady, and it's the capacity parts. It's understanding when people are off, it's sickness, it's leave, the importance of understanding that really makes a difference. So that really gives you that sense of control as an organization, and makes your GPs happier. So makes your GPs, but equally we're talking about not just GPs in general practice. We're talking about multidisciplinary, how your paramedics work with you, nursing, HCAs, and all the administration staff. So it's
Hmm.
interesting how this has started off thinking about GP demand, and we've moved right the way into secretarial demand, reception demand, making sure we've got enough of the whole team around.
Absolutely. So I think it's probably worth we have a look at that. So shall we have a look at what Tempo does and that kind of stuff? I think you've got some slides you wanted me to bring on. Is that correct?
Yeah, that's great. So I've got some slides I'll run through, and then James is going to do a bit of a live run through a couple of our screens as well. So yeah, we've talked about Tempo as being a universal workforce platform. So like I say, it's for all staff, both administration and clinical staff, and that integration through the rotas, the time off, and the capacity. Now, a bit of the journey really, as we talked. So it was actually built on the back of a locum booking platform. So GPNetworks has been operating in Sussex for over 20 years actually. So predates Facebook as a platform.
Wow.
And so it's been successful, and it's been a low-cost solution for locums booking in Sussex for the whole of that time. And it's one of our co-founders, Joe, who set that up in 2004. It became something for GP federations, so it's worked at scale, and it did all the COVID vaccinations. And it was when we came together, merging as a practice in 5 years ago. So 2019 was when we first started kind of working together, and then that's when we kind of moved into this, looking for a platform. And Tempo then started to kind of work together with GPNetworks, and it's been 4 years actually in creation. So rather than months, this has been years. And I thought it was going to be a simple task starting with rotoring, but as we've worked through the last couple of years, you realize it's actually quite a complex process. So we're now kind of nationwide. So as Tempo, we've got practices across York, we've got practices Bristol area, in Sussex and in London. So people are starting to see the benefits now, and it's good now that we've got to this point where we've understood that complexity and creating a platform that people can actually use. We tried other rota platforms before we started creating Tempo. So we'd looked at RotaMaster at the time, just didn't work for us because there's so many different moving parts that you need, that it does need that detail in order to properly work. Now, we've just talked about that integration and what it does and how it works together, rotas, time off, and the finance part of things. So from the time off part, we're using all the regulations relating to BMA contracts, Whiteley agreement, to ensure that we've got the right rules and regulations that allow people to have the time off that is entitled to. From the rotoring perspective, we're able to integrate with TPP directly, so we can put our rotors straight in just with a touch of a button, upload into the rotor area of TPP, which is a massive kind of time saving. For EMIS, unfortunately, we haven't got a kind of a direct integration to it, but we do have the ability to kind of map and kind of mirror some of the templates that are within EMIS. So it does still massively speed up your processes, but not quite as significantly as we can do with TPP. From the financial perspective, because we've integrated then costings, that's salaries, so for all your salaried staff, but it's also temporary staff with overtime and your locums all in one platform. And that then all pulls through into a payroll export. So it means that we've got a total look at what your financial costs are, what forecasting is, but actual costs. And that's where you can then start to look at efficiencies, altering maybe your forecasting for the future, changing your model of care, and then even getting down to the level of looking at kind of cost per appointment and how can we do that better as an organization. I think we covered some of these aspects in terms of the different areas we've talked about, leave and HR. We do some other fancy calculations, Bradford score calculations, which is really helpful. I mean, in particular around sort of administration and non-GP staff is often where people are keen to kind of look at that. But interestingly, we have started using Bradford scores even for our partners now to really kind of look at that and understand and think about, you know, how do we work as an organization? How do we support each other? And so when we're looking at sickness, what are the reasons for being off? But when we start to do some reporting, you can start to look at interesting metrics and see actually if we're rotoring better, if we're looking our staff better, sickness rate drops. So let's look at that as a metric that we can understand how we can organize our practice better. From the financial perspective, we've talked about kind of the flexibility of looking at both additional hours of cost, so with overtime, but also looking at payroll reporting, locum invoicing, all in one place. You talked about kind of appointments in terms of demand and capacity. Now, that's actually one of the key differentiators that we've got as a platform, is that we don't just rota relating to a session in terms of what activity am I doing for a block of time. We're rotating to the appointments. So we're actually counting and capturing all the appointment information. And that gives us the detail to then look in the future to look at, is my mixture of book on the day appointments to pre-bookable appointments, you know, is that right? Does that feel right? Are we matching demand when we're looking at what's coming through? And we use Anima as our kind of online booking system, but equally you could be using eConsult or others. But it's really understanding that urgent requirement as well as then your proactive and reactive care. So trying to get that balance right, and having those appointments in the rotoring helps you to do that, looking in past data, but more importantly, forecasting that for the future. Because it's once you can look in the future and you can start to plan and create a template for what your rotas look like, that's where you can really make a difference by using your information from your appointments in the past to plan something different for the future. I think we've talked a little bit here, and this is about, we've talked about that's kind of practice and process driven parts improving time. And then that benefit in terms of then how do you reorganize your practice? So understanding what your optimal workforce mix is, you know, is it right to have this number of paramedics, AMPs within the mix? Is it better to have more GPs? So understanding that kind of mix down to the appointment level, because often we're all working in teams now. You know, we're multidisciplinary teams working together. We're no longer GPs sitting in our room doing our own work by ourselves. We have to understand the team as a whole. So from reactive care, often using AMPs or paramedics, do we have enough? What's their skill mix? What's their capability? Understanding their capacity. And then from proactive care, understanding what we're doing for QOF. So understanding how many nurse appointments that we've got. Also looking at the mix that we've got in terms of being able to do the things that bring income. So when we're doing LCS or minor surgery work, then where can we fit that in? And when you're planning rotas in the future, it's not just about saying, well, when are the low times, holiday times when people are off, what's our minimum levels of staffing, but more, what do you do when you've got more people around? So how can you make the best use of those weeks when actually nobody's off? You know, they do happen. And if you can see them coming in the future, you can say, well, why don't we put on an extra minor surgery clinic, do some more coils, do some of the activity which is going to bring your income in. So having that kind of control and that forecasting is really allows you to do service level design and optimize what you're doing from a productivity, but from also from an income perspective. The platform itself is as a rotoring tool. You know, for GPs and as a clinician, I use it on my phone as an app. So that's where I can see where I am, what room am I in, where am I going to be, who am I supervising. But also I can easily then request leave or report sickness or do overtime. So that's all in one place, easily accessible on my phone. And then from a administrative, from our rotoring staff and HR staff and finance staff, they're obviously all using the desktop version. From a rotoring perspective, we've really tried to kind of clean it up, make it look kind of usable, make it look as simple as possible. And the dials are now what we're kind of using as this ability to kind of forecast and look in the future. So the dials are there to kind of tell us how many staff have we got in comparison to how many did we think we need. And then we've got a simple visual queue then, and loaded on top of that then is our leave requests and our leave bookings. So we can have a look at that and then see, okay, how many people can be off on leave to make it safe in terms of numbers of staff around. But also, as I said, looking in the future, if we've got more staff around, those dials become a simple visual representation of how we can then use our staff better. I was going to, at this point, I think, pass over to James. So this is a bit of a screenshot of one, but maybe we can just have a little look at the live platform.
Let's go for it, shall we?
Thanks, Phil. That's great. So this is the home screen of the desktop version of the app, and what I'm going to do is just going to take you through what the process of rotoring would look like, really, and a couple of the screens that we use. So the two key screens that we use in rotoring is the rota and the annual planner. And so if we look into the annual planner, and we're going to look at a week at the end of January, and imagine we're rotoring that. So the annual planner is a calendar-based screen, you know, with some filters on it for the type of staff that you're looking at, and then some options for different views of that staff. So I'm going to look at this week at the end of January. To begin with, what we've got here is what many people might see as their kind of master spreadsheet. So it's the people that you've got. This is GPs and registrars down the side, and then a simple visualization of their work plan. So each block representing a session and then the detail of what they're going to be doing in that session. If we click on one of these people, so this is a demo GP11. If we click into that, we can see what the detail of that looks like in the background, which is a more detailed work plan showing the type of session someone's going to be doing, the appointment design that's in there, the rooms that they're going to be in, and how that varies across the course of the week. So each one of these lines in the annual planner represents one person and their work plan. And so what we're doing there is starting off with what's the default, what would people be doing as a default, all gathered together in one screen like a spreadsheet to say, okay, what staff have I got and what would they usually be doing? And as Phil was saying, at the bottom here, we've got this dial which represents the total number of hours that we've got. And then this blue line coming up from the side, up to this line here, representing the hours that we need in order to provide the minimum level of service, our service design. Now onto that, I'm going to add on the leave that's been requested and any sickness, and we can then see that overlaid on the top. And then we can see that then affecting the dials as well. So the dials at the bottom then update to reflect that the leave that's being requested, and I can see, given the leave that I've allowed, am I still able to meet this minimum level of service that I've decided to provide, I've designed? And I can see that it's green on every day apart from Thursday, where it's red, and that means I've allowed too many people off in order to provide that minimum level of service. So that's that first view, really. I'm wanting to start rotoring, and I'm looking at who I've got available. Then the second window that I then will bring up is the rota window, and this is where I'm going to start to actually create the rota for that week. So I'm taking that master spreadsheet and then going to apply it to a specific week. So if I look at this empty week, I've got the two practices demonstrated there and some organizational wide services. So what I'm going to do is I'm going to load up that master that I've just described to you, that we've just seen in the annual planner, and I'm going to bring that into a specific week. So we see in that rota then created all the detail of what people are doing, the appointment numbers that they're doing across the course of the whole of the organization, across these two practices, some organizational wide services, and then all the way down at the bottom, I also then get some appointment counts, so some detail of the number of appointments that I've got, each type of appointment on a daily count, but also on a weekly count as well. And as I go down to the bottom, also some information about the book on the day versus book on advance appointments that I've got. So if we go back up to the top again, so I can see the leave that's come through. So some people are scored out on leave, and that means I know I need to switch somebody into a duty session to cover them. And if we've got time later on, I can show you how to do that. But one additional bit that's useful to look at is then recognizing the need for supervision. So we can see here Jasmine Carr as the registrar, hats appearing here to let me know that she needs to be supervised. And so I'm going to click on that, and it brings up some information there to tell me how much supervision does she need. So we've got the capability to put in there the number of minutes per hour that this person needs for supervision, so it can dynamically work out how much supervision she needs. And then in this list here, I get a list of the potential supervisors that are working at the same time as her, and a star for her preferred supervisor. So I'm going to click on that and create this relationship between the registrar and her supervisor. I can now see that appear in both Demo GP11's shift and hers. But I can also see that it's dynamically amended the appointment design to knock out that supervision time to reflect that what's needed for a Demo GP11 to supervise the registrar. Now this is quite a simple version of rotoring. We've got a whole load of different versions of this, and we have got multi-sited complex organizations also using this rotor functionality. But just as a sort of a way to be able to get a sense of it, then that's a sort of simplified version. That's the detail of it. I can then go back to the annual planner and then see what I've just done in overview. So this was back the view we had before, which was like the default design. If I then flip over into rotor assignments and hit refresh, then I get a zoomed out version of that view that I've just looked at. When we're doing screen sharing, always is slightly more delayed in terms of the screen loading. But let me just show you this here. So then this is the rotor that I've just created, and I can see that in this zoomed out view. I can see the people down the side and the detail of what they're doing. Some color coding to let me know who have I used, and is there anybody that I haven't used yet, so I can get this clear view on making sure that everybody that's available is being utilized. I can also switch over and then look at the rooms. So if I switch over to the room view, I can see the rooms that everybody is in across the organization, any clashes that are in there, and I can resolve any of those issues directly here in the rotor screen. I can then also see that from the perspective of the session as well. How many sessions of each type have I got morning and afternoon at each of the locations? And so as opposed to the view we had before, which was the person down the side, here we've got the session type. So how many duty sessions have I got? Who's doing that and what room are they in? How many standard sessions have I got? How many tutorials have I got? And so on. So really this comprehensive viewpoint on being able to see the rotor that I've created, start with seeing who's available to do it, create that rotor, see it in overview and down into detail. And that's all before anybody is informed about what they're doing. So in this rotor view, I've got the capability to make those amendments that I need without anyone being informed. And then I've got complete control to then decide at the point that that's then sent out to the users to be able to know what session they're doing, who they're supervising, what room they're in, and so on. So that's a bit of an insight just into a simple version of rotoring and how we consider those things like leave, capacity, a service design in the process of rotoring. I think I'll hand back over to Phil.
Thanks, James. Gandhi, do you think you could bring up my slides again, and I'll pick up from where we kind of left off there?
Yep, you should be on there.
Brilliant. So this is just a nice complex view just to kind of show the different elements that kind of James has just been describing to us. On the top left with our staff job plans that we've kind of described, we've got rota planning, and there's quite complex, and actually this is our template for our Foundry organization, which has got 3 sites, so you can see how much detail you can kind of go into with that. We've also got the capability to look at meetings that can overlay and also change the appointment structure if meetings happen to coincide with different sessions. And those meetings then allow you to kind of book up MDT meetings, cross-organizational meetings, the learning events. So very easy to kind of put meetings on the basis of the rota as well. So it's all in one place. The rooms, as we've talked about, is understanding room utilization, both from room type, so understanding how many clinical rooms are necessary, but also looking at maybe desk spaces when you can do some hot desking. So that means we can then look at the total available resources that we've got with room utilization. And then the supervision part we've just talked about there, and that doesn't necessarily just have to be registrars. We also use it for supervising our ARS roles, so for paramedics on the day who need a bit of supervision from a senior GP. So all of that becomes encompassed in your rota, so you're properly looking at the resources that are available and making sure that you've got enough people around to do that supervision as well. So putting in minimum numbers of how much supervision can one person do on one day, how many people can they supervise. And then we've got at the top there that import export. So that means that we've got that ability then, as we said, to kind of directly import once all of that's done. So you can do all of that complexity really quickly with an automated kind of rotoring process and then pop that straight into System 1. So that's the hours of saving that you're getting from doing that in this whole platform, as opposed to doing that exercise with rota planning through spreadsheets. These are some of the kind of the appointment counts that James has been showing us, looking at the weekly counts, being able to look at the number of book on the day and pre-bookables that you've got. So you can look and start to understand kind of targets and what we should be matching. And once you've got all that information, you can get some really interesting analytics out. Now, we've started using this as comparisons between organizations, as well as looking at what our organization is doing. So those people who are wanting to, so with Tempo, we can start to produce visualizations looking at the ratios of staff, looking at number of hours of staff per population basis, looking at the costs per population basis. And you can start to bring out some really interesting statistics, looking at the numbers of administration staff that you have, reception staff, GPs, paramedics, nurses. And I think that's where you start to spark ideas of how can I do things better? So rather than just having to only look at your own data, which is useful in its own right, is being able to do that comparator. And that's a comparator looking at appointment metrics in terms of past utilization, but also, as I said before, looking at forecasting. So looking at how can that model look different in the future and having a clear understanding of that. Alongside the kind of the rotoring part, we've got part of our package which includes a demand dashboard. So we're able to pull in data now from System 1 and EMIS, giving some clear representations of what your appointment utilization has been. And that's allowing us then to look more clearly at those demand metrics. And that's helping us then to plan those future rotas and really understand that a bit better. We've been doing so in future development. We've been looking, and we have done this in an MVP at the moment for Foundry. We've got data that we pull in from our Anima digital triage system, from our telephony system. We've also got task information, so starting to look at all of the non-appointment workload as well, and then starting to think about rotas, not just for the appointments, but also for the administration time. So thinking about how much administration time, how late are we staying, how much extra work are we doing, all those prescription tasks, all of those miscellaneous tasks, all of those non-appointment work. So we're building up now a database that's looking at the task data within System 1 that's also now starting to help us to inform all of that administration time. We talked a little bit at the beginning about how GPNetworks was actually the foundation of our platform. So it was a locum booking platform before we got involved, and it was a federation booking platform. Now, because we've got that in place, that means that Tempo can be used for your practice, but also groups of practices or as a federation, and utilizing locums in your local area. So you can bring in locums into your staff hub, and they can be there and they can see any shifts that are there and advertise directly, or you can advertise out into the wider locum network. So anybody then who's on the Tempo network, on the GPNetworks network, can then have a shift advertised. So that's been a bit of a whistle-stop tour. Hopefully that's been giving us a bit of an oversight as to the functionality and what we've got within Tempo. I've popped on the screen there our contact details. You can also find me on LinkedIn as well.
Perfect. I'm just going to leave that there for a second as we take some more information and stuff from others as well as that. And I'll put the links for that as well into the chat. So if you're watching us live or on the replay, you just need to click on that and it will take you straight to that website as well. So you can have a look at what they're providing as well as contact them from there as well. That's really cool. I've already got about 20 questions ready for you, guys. So I hope you're ready for all of this and things. And definitely can see the value of what you've got there. And what I love is the way that you can adapt and automatically create those rotas. And then you said as well from there, export that directly into the systems if it's TPP, and in a different way with EMIS. Am I right in understanding that level of integration that you've got there?
Yeah, so I think EMIS, we recognise there's a barrier, and with the current system of EMIS, that there isn't a direct import that we can use for rotas. So what we tend to do is we're mirroring templates. So we try and take the design, so within the templates that are within EMIS, we match them back in Tempo, and then by getting that mirroring, it smooths the process. It's not quite as smooth. With Medicus, we've had some initial discussions about becoming involved. So if we've got any practices on who are listening, who are thinking about going with Medicus, we're looking for our first kind of pilot to go ahead with that. So Emil from Medicus is keen for us to kind of get involved. We've had initial discussions with them and think there can be a real good synergy working together. So please contact us if you're thinking about that, and we can work together in order to do both the rota planning and with a new EPR system.
Mm-hmm. And I also saw that you had a kind of room planner almost that you can have and things. And I guess for me, one of the thoughts that might solve for a lot of people, and correct me if I'm wrong, because I think this is possibly an extension you've got here, is that you can screenshot or download or export that room planner, show that on a daily basis to your team. So then you've got less of that whole, oh, what room am I in? Trying to figure out, and that initial morning chaos that almost every practice deals with. Am I right in thinking that you can do that?
Yeah, absolutely.
Go on, James. I'll let you go first.
Yeah, so the staff members who are doing that, they can have a login and see the room planner in that view. Or yes, you're right, it can be downloaded and printed off or shared in electronic format. Not only that, but we also have the capability to look at over every hour of the day, what room capacity do I need in order to provide the design that I've got, and I can track that by hour. So because rooms are so key in terms of making sure that there isn't any overlap, when a nurse's shift finishes in the morning and the GP starts in the afternoon, so for those practices like ours where rooms are absolutely at saturation, you really need that hourly insight to be able to plan properly.
Definitely. Show me a practice that doesn't have a challenge with the States, and I'll show you a practice not in the UK. Let's put it that way. A bit more in terms of a bit more in terms of, I guess, into the HR side of things. So you mentioned about doing the rostering and the kind of the finance and the other kind of stuff that in there. Does that also include pensions?
Yeah, so what we've got is we're capturing all of the financial information, and that is salaries, overtime, locum invoicing between organisations, and included with that are the pension rates that are included in each individual. So we are able then to set individuals in pension rates within the NHS pension, or actually other pensions. So we've got organisations using Nest for some people who aren't within the NHS pension. And that then enables you then to do forecasting for gross costing. So you can look in the future NI pension costs on top. We then can produce pension reports that then show the amount that then can come through to payroll. We don't have a direct pension integration to the pension systems, but having all of that information there enables you then to look at costs. And interestingly, our part for this for the future is that we want individuals, people who've got those multi roles in terms of you working in federations, locum in a practice, being able to have all of that information in one place for you. So having all of that information, so because we can do both the locum and salaried and partnership costs, you can then start to do forecasting for you as an individual. So then starting to think about, well, what's my tax liability likely to be for the next year? How much have I earned this year so far? Am I tipping over across into that plus 100,000 income? What's my pension liability for this year? So that's where we're working towards in this next kind of piece of development, is understanding costs from both a practice perspective, which is great for forecasting, but also costs as an individual perspective for forecasting. So that can really help you to think about what work should I be doing? What days do I want to work? How much do I want to do? If I'm doing flexible careers, what other bits do I want to attach to that?
Wow. I mean, I can definitely see for many clinicians out there that kind of data, once that's available, will be really useful. And like you say, particularly with those interesting, weird tax traps that people potentially end up in as well, and continuity for practices because people are having to change their roles because of those challenges. Wow, that sounds awesome when it's done. I guess we're talking about a little bit about cost. It'd be worth asking that question. So what would practices be looking at if they were looking at joining Tempo and using the software and things?
So the full package, so when we've looked at the HR, the rotoring, including appointment booking, data analytics, all as all part of that as a package, that's 33p a patient that we're currently offering. And that enables you then to get the full onboarding with everything in one go. Now we have split out and we've got 3 packages, and if you can look on our website, we've shown you kind of what's in those 3 packages, essentially to try and compare us to other parts of our competition. So when you're looking at other rotoring platforms, and we've looked at Practice Index as well, and Omni Rota, we've tried to cost compare in terms of what does that look like. Now they do a simple rotoring kind of package, which looks at session-based rotoring without the kind of the detail that we're doing. So we do have a simple rotoring version, which is 9p per patient that you can use if you want to go down that route. We've also got an intermediary, which is 21p, that enables you to do the import into System 1 without having all of the finance aspects attached to it as well. So we've kind of grouped it together into those 3 packages. 9p for the basic version, 21p for an intermediate version with a System 1 import, and 33p for your all singing and dancing, financial forecasting, data analytics package.
Awesome. And is there any adjustments based on practice size, I guess? So if we're thinking PCNs, federations, etc., that kind of thing?
Yeah, well, get in contact with us because we've had discussions with some of the larger organisations. For instance, we've got a large practice that is the biggest is close to 100,000, and we've got some kind of active discussions thinking about super partnerships. So anybody who's interested from at scale, get in contact with us.
Okay. I know one of the other things that comes up often is the concept of onboarding. So, what does that look like if you're using Tempo? If they were to contact you, say, today, and say, I want to start using Tempo, what's the time it takes for them to get started with it? And also, what kind of information will be useful to have in order to start that process more effectively?
Yeah,
I'll let James answer. He's our onboarding lead.
So I think the obviously what we're doing here is a comprehensive solution, and I think if you're going for the full package with all of the HR detail in there and the rotoring and all of the financial analysis, then that takes a bit longer to make sure that those foundations are secure, that we've pulled all of that information in correctly. So I think broadly we've sort of split things into sections, which is getting the fundamental setup, which takes about 4 weeks, and then the rotoring depends quite a bit on the amount of standardization that there is currently. I think the minimum time to some simple base rotoring would be about 4 weeks, but that's quite variable depending on the size of the organization. And then to bring in the appointment detail, which is the next level of rotoring, is about another 4 weeks. And then the financial side of things again is about 4 weeks. So each of those sections it depends a bit on depends on the organization a bit. That doesn't necessarily mean that they all need to be run consecutively, so things can be run in parallel. So we work with each individual team within the organization, for the HR team onboarding that side of things, the rota team for that side. So they can be run in parallel. We've got a bunch of resources on the website that lead you through that journey, and we've got training resources, videos, and written resources. But also, we are integrally involved in that process. So you will be having regular meetings with you as you come on board with us, checking in about your key objectives, making sure that we're then aligning that onboarding process to your key objectives, and checking in both with the strategic people, the people who have made that decision to buy, but also the operational people who are then trying to deliver things with Tempo.
Awesome. So I'm going to see if we've got any further questions from those people watching us live. They do seem to be a little bit quiet, but maybe because you guys have given so much detail in the initial information that they may not have questions, which is fine. But I've got a couple more left to go. In terms of one of the things that I can appreciate every practice does slightly different is they have different rules, different kind of cultures of how they take leave. You know, particularly one person can't be off if another person's off, all those kind of restrictions potentially. And then when you include flexible working into that, it can sometimes get a bit more challenging. How does Tempo tackle those challenges?
So I think you're describing kind of the complexity, aren't you? And
yeah,
and actually these are multiple things. So this isn't like one thing. So what we've got within Tempo is we've in effect broken all that apart, and we've taken that down to what things are we actually thinking about there. So we've got, for flexible working, we've got people with work plans that might be at different times of the day. Yeah, maybe an alternate week. Maybe every 3 weeks I do something different. Maybe every 4 weeks I do something different. Might be something I do something different in the summer versus something in the winter. So what we've got is we've got the ability with different week mappings, with different work plans to kind of map all of that through. So we've captured all of that information around about that individual. For some people, we can restrict, actually, I don't do earlies on a Monday, but I can do earlies on a Tuesday or a Thursday. I won't be able to work later than 4 o'clock on certain days, but actually I could do on certain days. So we've got those restrictions that we can put in place that can capture all of those details, all of those little nuances that happen. And then when you bring that together in a rota, because you've captured all of those elements, that informs your rotoring and informs your leave planning, because you can put people together in different teams. So either teams of individuals are around, GPs, but also multidisciplinary teams. So looking at, we've got certain practices where it depends on how many paramedics are around as to what the GPs are doing. So you then build that into a multidisciplinary leave team that starts to set leave rules around more than one type of staff role. So we've got all of the elements that once you can bring them together, and because they're all there, actually you can do all sorts of things, and it really starts to pick apart all of those details. And those are the things actually that where they go wrong, because otherwise in a practice what's happening is it's generally the rotoring staff who are trying to manage all of that. So they're dealing with all of that in their heads, and it's really complicated. There's so many moving parts. It's no wonder it goes wrong. So it's only when you've got all of that in a platform that brings all those different elements, actually the computer can take care of that. That can then produce, and it's not computer says no, it's a suggestion. So it's saying, are you aware that we haven't got enough? Are you aware that that's not going to work? And do you want to override that? So it's not an on-off. It's a kind of an enhanced kind of way of rotoring that helps the rotoring staff to still be that individual who can manage that in the middle.
See, Phil, it's like you're telepathic. That was going to be my next question. What happens if you need to override something? So there you go. He's answered all the questions that we've got ready for us. If you want to find out more information, go for it, James. Yeah.
Sorry, I was just going to say, to add into that leave thing, I think one of the key changes, I think, for, in the leave management side of things, was that move from having the capability to do that, leave rule, which is we're allowed one partner or one GP off at a time or two GPs off at a time or that sort of thing, shifting from that to then thinking about actually how many people do we need in, and using that as the rule, as to define how much leave that you allow, because then that changes you from it being constantly in this sort of vague place to being very focused on your service provision and allowing different amounts of leave off at Christmas compared to in the middle of the weeks before quaff, the end of the quaff year, so that you're able to set different service levels and allow leave off when people want to take leave and keep people in when you need them.
Awesome. So what I'm hearing from Tempo is a platform that allows you to manage the complexities of rotas and general practice, which, let's be clear, that is complex, but also integrate that with practice level functions to give you an idea of the data that you've got, as well as functionality and forecasting to understand where you might be heading in the future, so that you can hopefully run a more streamlined practice and offer better care as a result of that. Is that a good summary, would you say?
Sounds perfect. Thank you, Gandhi.
No worries. Well, if people do want to check them out, definitely have a look. The links are down in the chat. Additionally, as you can see, they're coming up on screen as well to find out more. That's the site for Tempo to have a look at their product and platform. I'd recommend checking it out. It sounds absolutely awesome. Probably going to be sending this to my practice manager as well. And as ever, we'll be here to tech enhance your primary care and learning, and we'll absolutely catch you on the next show. Catch you later.